Get started here. Hello, everyone. Thank you so much for being here. So hello and welcome, everyone, and thank you for being here. My name is Alex Kim. My pronouns are he, him, his, and I am with Missoula's Idea for Racial Justice, as well as Empower Montana. And I will be your host today. We have people from far and wide in Montana and beyond, and we are so grateful for your presence. And many of us are very privileged today to be sitting in our homes on Zoom, which means that we are sitting on traditional Native American ancestral lands, and I want to make sure that we are taking time to honor and acknowledge Indigenous peoples of Montana are the caretakers and stewards of this land. Now, racism, hatred, systemic failures, and systemic oppression continue every day, even in the midst of a pandemic. And we hope that you can find this time to be encouraging, engaging, and informing on matters that affect all of us. We will also be sending out a poll for those of us that are on Zoom, and if you are on Facebook Live, please submit your email on the event page. We would love to be in touch with you for future happenings. And we know that there are so many communities, families, people struggling during this time. If you're working with marginalized communities or in the racial and social justice work, and interested in a webinar and talking about what is going on, please email me at alex@empowermt.org. Also, a trigger warning, we will be covering topics that may be sensitive, so please be aware and please know it's totally okay to walk away. And a huge thank you to all of our participating organizations. Even in the midst of all of this, it's amazing to be able to come together in solidarity. And so please show all of these organizations some love. Their links are on the Facebook event page. So we're going to dive right in. Here's the layout for today. Today we have 8 presenters. Each person will have 10 minutes to talk. We will not be taking questions. If there are questions, please post them on the Facebook event page or the chat. We will begin with some historical context. So first we have someone who is a mentor to me, a brilliant scholar, and Professor Tobin Miller Shearer. We'll let Tobin take it away.
Okay, thanks Alex for starting us off and for all the work that you've done to make this possible. I'm going to jump right in. My name is Tobin Miller Shearer. I'm Director of African American Studies and a history professor at the University of Montana, and I use the pronouns he, him, his. History offers us a rich treasure trove of information. In a crisis, it's invaluable, but it can also be dangerous. False parallels between the present and the past can misguide us. Cherry-picking historical data can create unrealistic expectations, and the complexities of historical circumstance can seem overwhelming. In a moment like the one we're facing, the challenge is to assess the strange country that is the past in a way that has integrity and apply the lessons learned from that unfamiliar country with care and nuance. So I'll attempt to exercise that kind of interpretive discipline and analytical caution as I link the past to the present by asking what our collective experience with scapegoating and infectious disease has to say to the reality of COVID-19 here in Montana. I'll offer 3 observations and then the same number of principles that, well, I hope, help prepare us for what comes next. First, a more general statement. We as a nation and a global community have gotten through pandemics before. We'll do so again. The question is not whether we will get through, but how. And collectively, we're offering input this afternoon to help prepare us to get through in a way that not only honors the best of our country's democratic ideals, but one that also lifts up our best anti-racist principles and practices. I'll begin with 3 historical observations. Number 1, infectious disease outbreaks in the past have been repeatedly linked to the scapegoating of religious and racial minority groups. Number 2, that process of scapegoating needs to be understood in the context of the historical intent to use infectious disease to take land from indigenous communities. And number 3, the very community tasked with responding to infectious disease outbreaks, which is the medical community, has a highly compromised record of engaging with communities of color. So I'll give a few short examples to explain each observation. Number 1, to repeat, Infectious disease outbreaks in the past have been repeatedly linked to the scapegoating of religious and racial minority groups. Examples abound. During the 14th century plague, Christians murdered, buried alive, and burned at the stake members of the Jewish community who they blamed for the outbreak. During the 1832 cholera outbreak in New York, residents there blamed and attacked members of the Irish Catholic community who they claimed spread the disease. During a smallpox outbreak in San Francisco in 1876, the community there attacked Chinese residents, attacks that helped set the stage for the 1882 Chinese Exclusion Acts. Number two, that process of scapegoating needs to be understood in the context of the historical intent to use infectious disease to take land from indigenous communities. We have specific historical evidence that William Trent gave 2 Delaware Indians blankets infected with smallpox at Fort Pitt in Pennsylvania in 1763. We actually have less evidence that the blankets work to transmit disease, but that's not the important point here, because due to the realities of disease transmission as British colonialists took over Native American land, smallpox and other diseases introduced by Europeans spread and helped weaken indigenous resistance to military advances. That took place without any need to offer smallpox-infected blankets. The key point is that, as has historically been the case, the spread of infectious disease has its most devastating effects on communities already compromised by the effects of institutional racism, poverty, and colonialism. What was true in the past remains true now. Number three, the very community tasked with responding to infectious disease outbreaks, which is the medical community, has a highly compromised record of engaging with communities of color. Again, examples abound. In 1932, the US Public Health Service recruited a group of 399 sharecroppers in Macon County, Alabama, who had latent syphilis. The men received placebos and were denied treatment by physicians in the area at the request of the Public Health Service. Researchers then tracked the progress of the disease, even as the men died, became blind, and experienced dementia. Likewise, since the Civil War, a medical instrument used to measure lung capacity, known as a spirometer, has been calibrated based on racist assumptions about African Americans. During the antebellum period of enslavement, white enslavers claimed that African Americans had weakened pulmonary organs and were thus only suitable for field labor. The instrument continues to be used today despite this racist calibration. And in our contemporary setting, more recent studies on the phenomenon of implicit bias have shown, for example, that physicians are more likely to prescribe painkillers for white patients than for Black patients. These 3 observations need to inform our planning for the future. While the past cannot and never has been able to predict the future, it can help us plan for what comes next. So, because we know that infectious disease outbreaks in the past have been repeatedly linked to the scapegoating of religious and racial minority groups, we can equip ourselves with strategies to interrupt that process. Civil rights groups have already documented more than 1,000 instances of anti-Asian American and Pacific Islander discrimination since the onset of COVID-19. To repurpose a saying from Homeland Security, if you see something, say something. When you see acts of discrimination, interrupt them wherever they show up. In a time of shelter in place, consider practicing interrupting racism through role-playing, evaluating case studies, and financially supporting the work of the groups represented in this webinar. Also, because we know that the process of scapegoating needs to be understood in the context of the historical intent to use infectious disease to take land from indigenous communities, we need to advocate in particular for the communities of color who are made most vulnerable by outbreaks such as these. In short, we need to ensure that medical and financial resources are directed their way and not just toward white and wealthy communities. Again, we already have evidence that these communities of color are being abandoned with devastating results. And because we know that the very community tasked with responding to infectious disease outbreaks, which is the medical community, has a highly compromised record of engaging with communities of color, We can act to hold that community accountable, even as we celebrate the heroism that is and will continue to emerge from healthcare workers on the front lines. We can remind ourselves as well as healthcare professionals about the realities of implicit bias, unequal access to healthcare, and the ongoing racism within the healthcare system, and then join those healthcare workers in honestly and openly addressing those inequities, especially in the midst of this current crisis that we face. Once again, we already have evidence of doctors being less likely to order COVID-19 tests for Black patients than for white patients. We need to push back against those practices now. The past awaits to inform us. May we pay especially close attention in this time of crisis. We've dealt with infectious disease outbreaks before. We can do so again, and we can do so in an anti-racist way. The choice is ours. Thanks for your attention and consideration. We'll now hear from a colleague and friend who I hold in the highest esteem, Rachel Carroll Rivas of the Montana Human Rights Network. Thanks so much. And I will move out of that.
Hello, everyone. I'm Rachel Carroll Rivas with the Montana Human Rights Network. Can folks hear me? Great. I'll go ahead and get my screen sharing going here. Excellent. Great. Well, thanks so much, everyone. I'm really glad to be here. I'm Rachel Carroll Rivas with the Montana Human Rights Network. I use she, her pronouns. I'm going to talk a little bit about exposing white nationalists during the COVID-19 conspiracies, rejecting anti-Semitism and anti-immigrant blame, the warnings about white nationalists' online student recruitment efforts, and then actions you can take right now. So, yep. So who we are and what we know from experience. The Montana Human Rights Network has been researching and responding to white nationalists and the anti-democratic extremists for 30 years. And we've learned a lot about their ideologies and their strategies. We know for sure that these groups exploit every difficult circumstance and wedge issue in order to promote their agenda of racism, anti-Semitism, xenophobia. And next, they incite people to violence in order to normalize acts of racism and open conflict. We also use at the Montana Human Rights Network a three-pronged approach. We pursue progressive public policy, oh boy. Can you hear me? Anyone on the online? Great, okay. Back to sharing here. Here we go. And then we use community organizing and then research to shine a bright light on extremism. We use a human rights framework that counters white nationalism. We work on economic justice and LGBTQ equality. And then what we can say about why we need to understand anti-democratic and white nationalist movements is that by shining the light of public scrutiny, we really expose them because they want to be secretive. And we can dictate the coverage that they are actually hoping to dictate. So we can sort of change that. We also find weaknesses and predict the next moves. We can get rid of fear to make sure folks really understand what we are up against, the size and power. And in addition, we can prevent acts of violence, which is most important. So the tactics we're seeing right now are the physical targeting, the pushing of eugenics-esque policies, the attacking of democracy, and online organizing that includes blaming minority groups, promoting doxing and hacking, and recruitment. So first, to talk a little bit about the hate crimes and targeting, building off what Tobin said, under the current COVID-19 crisis, white nationalists have turned their attention to the Asian community, folks of Asian descent, and are repeatedly referring to this as a virus as the Chinese virus. It's hard and difficult to fight an unknown, unseen, terrifying disease, but extremists are always looking for enemies, and they've turned to attacking the Asian American community instead in the US. This bigotry is played out across the country in all kinds of ways, in physical acts of violence and threats of intimidation. For example, on the screen, you'll see that folks are spreading the rumor that COVID actually stands for Chinese originated viral infectious disease, and this is false. And that diversity has left to this and promoting violence against folks who may be displaying some form of sickness and be of Asian descent. In Montana, we're actually seeing this being promoted by folks like the Montana Shooting Sports Association, trying to upplay the purchasing of guns and arming folks in response to this, quote, Chinese virus that they're using the terminology of. And then as well as folks like Carroll and Solomon, who are with one of the largest anti-Muslim groups in the state that had a chapter in Montana, and now a broad extremist organization in the state, calling it, again, this Chinese virus and claiming it's really particularly the fault of folks from China. We know that this is having impact on students, businesses, and of course, individuals across Montana and the country. In terms of eugenics X policies, what we're seeing is that white nationalists are inserting themselves into social and political debate on how we should be handling COVID-19 as a community. And they are talking about the fact that some folks deserve to be sick and other folks deserve to be saved. This is particularly includes attacking the LGBTQ community and people of color. These are just two examples of things that are going around online, including, you know, again, hoping that LGBTQ people are victims of this pandemic, and that actually promoting trying to make minority folks sick. This also includes advocating for long-term immigration bans and policies like the Muslim ban, long-term impacts on communities of color and immigrants, not just sort of the stay-at-home orders right now, but actually like policies that would be into the long-term future. So what the online organizing and doxing, hacking conspiracy sort of look like? You know, it seems to us that every fraction of extremism is dealing in conspiracy theories, including militias and white nationalists. They promote discrimination against Jewish people, Black people, Muslims, Indigenous folks, immigrants, and others. And right now they are just online like wild and spreading misinformation and scapegoating. Since many people are getting their information on COVID-19 online, white nationalists are looking for openings, YouTube, Instagram, other platforms to amplify their talking points. And there's an uptick in visitors. And, you know, this includes websites on survivalist tips and alternative medicine, COVID-19 updates. They're looking for places where they can promote their core message that white people are good and other folks from different ethnic backgrounds and from outside the US are dirty, unclean, or enemies of the state. And this is just some advice that we see given to white nationalists by the Daily Stormer. On your page, you can see that they're talking about using that joking tone, that sort of ironic tone, and that's purposeful. And then imagery of here, you know, depicting that Jewish people are behind this because they're seeking to profit from it, which is completely false as well. Using coded language, it's important to understand the codes and to point those out. In this case, we see David Clark pointing out that he believes George Soros is behind this. And that's, you know, a coded language that George Soros, a Jewish philanthropist, stands for all sort of Jewish people in this case, being blamed for the pandemic. And we're also seeing online organizing attacking democracy, and that means promoting militia activity and, you know, really questioning the legitimacy of our democratic governments. Or we see private entities providing emergency services that the government is supposed to be providing that then enshrine and promote discrimination against LGBTQ people, people of color, etc. So white nationalists are also targeting our youth and expanding their online organizing. We are especially concerned about teens and college-age students because the schools are closed and many students are now online doing classwork. There is an extremely active online white nationalist network and has been for decades. We know that groups like American Identity Movement have been active in Montana, and they're looking for curious students who are just researching history or politics and current events. And they have prepared polished clips on YouTube to bring folks in on pages like PagerU that are full of misinformation. And they wanted, you know, they start talking about immigration or slavery, and they cleverly introduce white nationalist talking points in the hopes of bringing them into their fold. We wish we could tell you exactly which sites to avoid or block, but the fact of the matter is groups like Montana Rights Network and others have been getting some of these sites taken down, and so there's new ones that just pop up. They're promoting their agenda on sites that appear to be mainstream and presenting memes that are shocking and sort of have that kidding and ironic flavor to them. And they're also subtly sometimes racist, but still very serious. So we are going to give you some keywords and phrases that you know so that you can talk to children in your life, ask questions. And some of those symbols and rhetoric include things about Nazi Germany, like 88 for Heil Hitler, the Holocaust, name games like racialist or separatist, symbols like the Confederate flag or the Iron Cross, and the number of keywords that include Rahowa and 14 words, triggered, boogaloo, things that you should be aware of. And, you know, these white nationalists are especially seeking out young white male students who've had a rough time in school or traumatic childhood or are in crisis like many of us are now. So they're trying to draw these students into the community and give them leadership roles and a sense of belonging. So sometimes othering is political too, like Charlie Kirk, who visited Kalispell in March, and he encouraged students to secretly record their teachers during this time to indoctrinate about charging these professors and teachers with indoctrinating students. He said that now was the time to expose the radicalism of our schools. So we need to be aware of this. We have a long report on our website about Charlie Kirk and TPUSA if you're interested. So what do you do to address youth recruitment? The best tool is prevention. Have those hard conversations about differences and race and gender and about discrimination and how it happens. And then when you do have concerns, you don't want to necessarily just push back and take devices away right away and punish. You want to talk, decode, and ask questions. We'll also recommend, and I'll put in the chat, 2 articles, Racists Are Recruiting, Watch Your White Sons in New York Times, as well as A Mother's Warning, If You Have White Teens, Listen Up in CNN. So what can you do? You can physically distance, but have social solidarity. Understand strategies that counter and don't feed. Be proactive to build coalitions and support networks. Use cultural strategies like theater and art. And right now in Montana, especially for white allies, we're asking that you ask Montana leaders that our COVID-19 response policies address the existing inequalities that are out there, that these are not race or class neutral policies. So if you are a victim or witness yourself an active hate incident, you can go to our website and report that, and other groups here today, and it can be made anonymously. We also offer a hate incident rapid response guide that you can use if you want to respond yourself. That's all I have for myself, and I'm going to go ahead and pass it on to Ivan MacDonald of the Urban Indian Health Center. Thank you.
Okay. Hello, everyone. My name is Ivan MacDonald, pronouns he, him, his. I'm one of the behavioral health clinicians with Missoula Urban Indian Health Center, and I'm also the Native American liaison for the Missoula County Detention Facility. So I just want to talk a little bit about what MUIHC as a Urban Indian Health Center is providing as far as services during the shelter-in-place order. We are providing virtually all of the same services we were providing before the shelter-in-place. I spoke with our medical provider today, and she's still doing appointments, of course, telehealth appointments. She's providing medication refills. She's getting a lot of inquiries about continuing services or entering in services. We have seen, I think just at the urban center, from what I've heard from other urban centers, there has been an influx of patients. I don't know whether they feel safer because it's not a hospital where there may be exposure to COVID-19 patients, but I do know that is something that I've seen discussed. Being in the behavioral health department is virtually providing all services that we did before. So we're doing mental health, but a lot of it has moved to the virtual realm. So we are doing one-on-one behavioral health appointments, still doing our chemical dependency appointments. I was told recently that they're trying to slowly move to doing chemical dependency evaluations online. I'm thankful that the state has pushed for a lot of resources to be sent for telehealth. I think as telehealth providers, whether it's behavioral health, medical care, for the time being, I see that as kind of a new realm that a lot of us can adapt to. Yeah, and so as I said, MUIHC particularly serves a population that in sort of any pandemic times are prone to health disparities. And that is something that I do see around the state from a lot of the other tribal communities are taking this COVID-19 pandemic very seriously, whether it's closing their borders, monitoring their borders. IHS is kind of in this realm where there is some more independence. So I do know that there are some places that are Indian health service providers that are getting their own testing, regardless of whether the state has say. But yeah, you know, that's just something that wanting to provide at MUIHC is just support. I've been doing a mindfulness class or a mindfulness video that I've been posting to our social media. I'm going to be doing that every other day, Monday, Wednesday, Friday. I think the next one is supposed to be going up this late afternoon. And that's just, again, you know, we're just trying to find ways we can support our community in this time. It is a very challenging time. I think that as we are still in this shelter in place, like for the foreseeable future, I do think that telebehavioral health is going to become more important. I don't know if a lot of people have seen the recent stats showing, you know, increases to the suicide hotline for the state of Montana. So I think being able to provide, and that's maybe something I can work on getting put together, being able to provide not just for the Indigenous community, but what is happening most likely in Missoula community as far as providing that support, that mental health support that, you know, in this time in history we need. So I'm going to be slowly working on that, and I know we're hopefully going to be providing updates from this webinar, so that's something I could search out and see. And as far as my other duties, working in the jail, that is something that actually my last day of physical work was at the jail. I was there doing classes, providing support, doing one-on-ones, and you know, that is something that was a reality for them. It was kind of before all of the shelter-in-place orders happened, so about 3 weeks ago, and you know, the fear of a COVID-19 outbreak was something that was discussed in a lot of the group work and one-on-one work. And as someone had said in the comments, there is a petition to the ACLU of Montana. So Governor Bullock just released a directive earlier this week regarding the prisons and the jails in the state. Many of us who do work in there didn't think it went far enough as far as clear directive release orders for low-level offenders, people who don't pose a threat to communities. And I do know that particularly across the prisons and the jails across the state, I do know that a lot of the releases from what I've understood have been a bit on the slower side. So I think just pressuring our lawmakers, whether that's local or state level, to provide some of that support for the people in jails, because you know, jails, most research modeling shows that jails are kind of the perfect place for sort of pandemics to happen. Closed quarters. I know that in the Missoula jail, there's often 3 people to 1 cell. And so when you kind of think of the dynamics in a jail, you know, the outbreaks that happen there will be devastating. So I think that someone did post the link to the petition, the ACLU petition in the comments. But, you know, I do think that is something that if you're looking for maybe direct action or a way to empower yourself, I do think that is something you can do. Contact your legislators and ask them to really support the release of inmates so that we avoid a health pandemic in our jails and prisons. So I can pass it on to the next. And I'll also be, whether I post it in the Facebook or the Messenger or the chat, I'm going to be trying to providing some telehealth behavioral health services that I do know are being provided within Missoula.
Great. So thanks for that, Ivan. My name is Meshayla, and my pronouns are she, her, and hers. Just want to make sure I have my screen up here. Can everyone see it? Good. Awesome. So I work for the Montana Racial Equity Project as the Program Events and Outreach Coordinator. We are the only Black-led nonprofit in the state, and we work to advocate equity and justice for all historically marginalized, disenfranchised, and oppressed people in Montana. However, at the forefront of everything that we do is race, because we know that as a society and as a country, we have a tendency to kind of push it down into the basement and hide it behind all the boxes. And we do this by educating, training, and activating organizers, individuals, groups, organizations, businesses, you name it, to invest in interrupting racism whenever encountered. So we know that this is a very difficult time for folks. Things are changing every single minute, and we're just all trying to do our best to limit the spread of the virus, save lives, keep our jobs, and we recognize that this is going to be the long haul. However, as Tobin mentioned before, racism doesn't stop even during a pandemic, and neither do we at the Montana Racial Equity Project. And in fact, racial and economic inequities are further illuminated and exacerbated through times of crisis. So now more than ever, it is important that folks join in and continue anti-racist efforts. So again, the use of phrases like Chinese virus, Wuhan virus, or a virus brought by foreigners, and other racist tropes and dog whistles are an attempt to relieve US of blame and point the finger at China. Our language has immense power, and the racist rhetoric being spewed by folks in power has resulted in an increase, as Tobin mentioned before, of anti-Asian attacks, with now, I think, recorded 100 hate incidents a day. The World Health Organization, WHO, deliberately chose the name COVID-19 to avoid stigmatizing minority communities. There is this long history of naming diseases after the place where they were discovered. However, in an act of anti-racism, the WHO decided to change the language used to describe viruses and diseases. Our individual, organizational, and governmental inability to change such language can have devastating economic and devastating consequences, and it can lead to discrimination against people who are perceived as disease carriers only because of their race or their ethnicity. So just as COVID-19 spreads, so does racism, bigotry, and xenophobia. And although we are practicing, as Rachel said before, a physical distancing, it should not keep us from engaging in racial and social justice work. This public health crisis is highlighting the economic injustices that already exist within our society and harms our most vulnerable populations. There's an old saying in Black communities that when white folks catch a cold, Black folks get pneumonia. And this means that although an unstable or declining economy might pose hardships for white people, it is oftentimes deadly for Black and Indigenous and other people of color who are already hit the hardest by racial disparities. Health professionals have said that people at higher risk for serious complications for contracting COVID-19 are the elderly, people with pre-existing conditions such as lung disease, diabetes, hypertension, and these are all things of which Black people disproportionately suffer. So it is likely that we will be hit harder by the disease. And we are less likely to have access to health insurance, and less likely to have a regular doctor. And these all create a situation in which we end up dying from diseases at higher rates than other racial groups, largely because we don't get treatment in time or we don't get adequate treatment. And I fear that COVID-19 is disproportionately affecting these communities of color in this moment. I know that myself, along with other Black and people of color, often don't feel welcomed within the healthcare system. Tobin gave us some great examples of ways that communities of color have been misused, abused, and exploited by the healthcare system. And so this has caused a large distrust in healthcare and medicine, a constant feeling of being devalued by medical providers. There's so much more information you can get into on this topic, and so there's a few resources on your screens here. And this is a very, very limited list of books. I think these are some really good starting points to learn more about Black and Indigenous relation to the healthcare system. Black healthcare providers are currently working to address these issues, but they are largely underfunded. Right now, Black doctors are especially worried about the effects coronavirus will have on minority communities and how testing and services will be shared as the virus spreads. Again, another worry that Black and people of color will not receive adequate treatment in time. Racism is embedded in every part of our society, and this includes how we handle pandemics. We don't want to look back on this in the future and think of all the what ifs, what we could have done, what we should have seen, what we should have said. Instead, we have to have the courage to be anti-racist in this moment of crisis. So if you consider yourself an anti-racist or an ally, then you should be completely pushing back against all forms of discrimination and racism and xenophobia. And I'm going to quickly just outline 4 ways I think you can begin this fight against racism and inequities in this time and every day after. 1, interrupt racist stories and rhetoric about who is to blame. Call out misinformation and racist language being used in the media. Maybe it's being used around your kitchen table or on your Zoom calls. You're hearing phrases like Chinese virus, Wuhan virus, or Kung flu. Have an informed conversation about this racism and the lies that are being spread. And keep an eye out, push back against dog whistle rhetoric, such as that spoken by the Montana Secretary of State, Corey Stapleton, who referred to COVID-19 as the Wuhan Black Swan in an email. Work hard to obtain your information from articles written by Black and Indigenous, people of color, activists, especially those who are physicians. And 2, support Asian restaurants and businesses. Use your privilege. If you are able to help folks financially, then this is the time to really do that. Many Asian restaurants are dealing with racist attacks and decreases in business due to the anti-Asian sentiments we're hearing in the media and from our government officials. So you can support them by ordering takeout and giving a hefty tip, ordering some gift cards. You could donate to Asian-led and anti-racist organizations as well. And I'd like to just piggyback onto that is to look into ways you can support undocumented families and undocumented farmers specifically who are dealing with this crisis as well. 1 and 3. Join an anti-racist group or further your work with one that you might be already engaged with. There's a ton of people on this webinar that you can get connected with and start to engage deeper in your anti-racism work. So I invite you to engage deeply with some of the folks on the webinar that you're hearing from today, and to ask yourself how you can help dismantle racism in healthcare and support communities of color, especially in this time of crisis. And above all, support free and accessible testing in your state or in your community and advocate for that hard. 4th, participate in a mutual aid project or fund. We at the Montana Racial Equity Project know that many in Montana, especially the most vulnerable in our communities, are experiencing a serious financial crisis due to the economic impacts of COVID. And as per our mission, we find it critical to help facilitate the distribution of resources for our state's most vulnerable. So through kind and empathetic donations from supporters and foundations, we were able to establish a COVID-19 crisis fund, and this is a low barrier process designed to provide immediate assistance to folks in need. We gave out over $4,000 to Black, Brown, Indigenous people of color, LGBT+, folks with disabilities, and undocumented families, and that all went in less than 24 hours. So if you are in a position of privilege, we are accepting donations through our website. Just use COVID-19 in the comment section, and we will 100% of those funds go back to the communities of which we serve. And I'll bring that screen back up at the end. And also look for mutual aid networks in your community. I'm currently located in Bozeman, but I know also in Missoula there are community members and leaders who have been offering information and resources and services to folks who have been affected by the crisis. Where there are nonprofits and concerned citizens, there are community organizers, and I'm sure there are folks responding to the needs in your community. And on that note, I will pass it off to Vasu with Eagle Mount, Earth Tone Outside, and the Bozeman COVID-19 Mutual Aid Network. Take it away. Yeah.
Awesome. Okay, let's see if this works. Can everyone hear me? Is this working? I feel like you're still on it. Okay. I still see Meshayla, so I'm trying to see how I can get on there now. Pin video. Okay. Can everyone hear me? Thumbs up? Sweet. Awesome. I am going to share my screen here and get it going. Share that. Awesome. So I am representing Earth Tone Outside today, as well as the Bozeman Mutual Aid Network that we have created in conjunction with a bunch of nonprofits that are in Bozeman. So Earth Tone Outside was and is created to elevate the visibility of Montana's diverse outdoor population and enthusiasts. So we're trying to create an organization, an affinity space for folks of color and different diversity and international groups. This is a photo from our ice climbing this season. And I'm here to talk to you about how to support and mobilize your privilege and how you can make a difference in your community. So we have a ton of emotions that are running through us. I know I've probably hit every single one on this giant circle. So I just want you all to understand where you are at internally, as well as understanding that you can use that internal emotion to try to mobilize and do some actionable items that can help our community be together again. We're all in this together, and we need to hopefully be stronger when we get out of it. That's all we can hope for. And through this, with Earth Tone Outside, as well as all the other organizations and the Bozeman Mutual Aid Network, is we really try to focus on solidarity and not charity. And that comes with building relationships and rapport with the communities that we're working with, saving our savior complex for someone else, but like actually not really even having a savior complex in the first place. So that comes with asking what the needs are of those communities as much as possible. And then it's just helping people. So with the Bozeman Mutual Aid Network, we're not a nonprofit. We're just kind of doing what we can with what resources we have available and just trying to pull it from other folks that might have more privilege than us or have more resources available than us. So we're just trying to network people in the right places. The other day we were able to get 2 cords of firewood for the homeless camp, which is amazing. So they're staying warm, and that was thanks to Hopa Mountain. And then today we just got 40 tents donated as well. So we can just try to help people, and that's all through just community efforts of communicating what our needs are and what the needs of our those most affected are. And again, it's not a marathon. It's a marathon, not a sprint. So we got to get through this in a slow, steady process of just enjoying how we can help each other out. Next is, as the other folks in this panel have been saying, is keeping in mind that due to historical trauma, land loss, systemic racism, ableism, homophobia, xenophobia, and other systems of oppression, we have to equitably work to distribute our resources to those mostly affected. And that comes with consent, as well as asking those communities what their needs are. This isn't that, again, savior complex of just going in and just doing things for them. It's asking what they need and what we can leverage with our privilege, our money, our space to those more vulnerable populations. Especially, as we were saying, folks of color, Asian American and Pacific Islanders, undocumented, disabled, sick, ill, old, all the ones that are really vulnerable right now. It's America is really showing its true colors as to how inequitable our healthcare system actually is. And then these are some ways we are able to activate our privilege. On the left is what non-Asian Americans are able to do. So we have to recognize, as a lot of our folks have been saying, is COVID-19 coronavirus is not recognizing race, nationality, or ethnicity. It is a virus that affects all of us. So just making sure that, I mean, it did start in Wuhan, but it is affecting every single one of us. And regardless of race, we can't stigmatize certain races that they are sick. And then also, if you speak, see, read misinformation or harassment, call it out, stop it from escalating as much as possible, because that does affect those vulnerable populations. there's a lot of trauma that is created from it. And then interrupting the stigmas again and start sharing accurate information. A lot of the CDC and a lot of other folks have been sharing very prevalent information as to how to keep that social distancing, which is again a privilege to be able to prioritize that. And then also understanding that wearing a mask doesn't make a person ill. It is part of a lot of cultures to wear masks, especially in Southeast Asia or China, India, where there's a lot more pollution in a lot of the bigger cities. So it's more culturally appropriate to wear those masks for a lot of those folks. So we have to remember that because they're wearing those doesn't mean they're ill. And then also leading with compassion and understanding that we don't know everything, and we have to ask our communities that are being affected by this what they need and how we want to help support them. And to my Asian American and Asian Pacific Islander relatives, I want to make sure you guys are safe as much as possible. You all are safe as much as possible. And reaching out to your friends who can validate your experiences, that's always helpful. We don't want to stew in our own grief or guilt for not being good enough. So please reach out to your friends as much as you can. Try to pull yourself away from the TV and all the headlines, because there's a lot of negative media going on out there right now. And if you have to go out and go grocery shopping or anything, please try to stay vigilant, be on your toes. It is a scary time for a lot of us, especially our AAPI friends. And if need be, you can ask your more privileged friends that don't feel unsafe to go shopping for you, just creating a list and having them go shopping for you so you don't feel as vulnerable. And again, if you're getting discriminated against, put your safety first, get out of the situation. A lot of these white nationalists and supremacists are scary because they really enjoy their guns and weapons and stuff. So just make sure you're stepping away from that. Lean into some of your own culture's art, literature, music to be validated. That's always important. And that's how I use healing in our own community to try to validate myself. And remind yourself that this is part of a larger story, as the folks prior to me have talked about. Xenophobia and victim blaming and all this kind of scapegoating has been a huge issue in the US since the conception of colonizers taking up this space. So please be aware of all of these. As Meshayla was saying, here are some talking points around undocumented folks. So a lot of folks that are undocumented can't buy over-the-counter medicine. So if you do know them, try to help that. Like even allergy medicines and stuff like that is really hard to buy. For a lot of us, it's hard to accept money. So maybe gift cards to grocery stores is always helpful. And then dropping off essential bags, so cleaning products or, you know, just veggies or something like that. If you know them, again, ask them what their needs are as much as possible. Come up with a list of things that you can offer with the skills that you have, and ask them if any of those would be useful to them. So things like, you know, tutoring their children or being able to babysit their children if you've been in a close proximity to them. Be aware of that social distancing. And then, you know, don't panic around undocumented folks. A lot of people get a little uncomfortable around folks that might not have documentation. So again, we are all people first, including folks that don't have documentation. So just do not panic, be yourself as much as possible. And then also acknowledge that undocumented folks are resourceful and knowledgeable. They've gone through a hell of a lot to get to where they're at, and it's pretty impressive to see that as well, being able to get by because of some pandemic. We have a lot of marginalized groups have already gone through similar circumstances of feeling uncomfortable, feeling unsafe in a lot of spaces. So we already know a lot of tactics on how to work around that. And then use them for guidance. Again, ask them what their needs are. And last but not least, a lot of us might have still full paying jobs. So income distribution is important when it comes down to it. A lot of them have it in the service industry or the labor sector. So making sure that they're provided for. A lot of us might get through this with excess or scarcity. So there's going to be quite the shift in the economy once this is all over. Another thing that I want you all to understand is that when we say we're all in this together, it means that we all have a part to play in some way. So either we are weavers, we're visionaries, we're builders, we're caregivers, we're disruptors, healers, storytellers. We're all in it together to try to keep our ecosystem sustainable and the reciprocity available to all of us, including our other than human beings. The builders that are in our communities right now, these are just a few of them. And these are all just only Facebook groups. So the Bozeman Mutual Aid Foundation or Network is one in Bozeman. Missoula has one as well, and they have over 4,000 people in it. There's also the Gallatin Valley Support Volunteers, which has around a 2,000 limit or volunteer number. And we have just been helping each other out on how to provide the resources that are needed for a lot of the more vulnerable communities. The caregivers, there's the mask makers that are out there. There's manufacturers out there that are making 3D printed masks or plastic masks to help our medical workers, healthcare workers. So those are the caregivers. And then there's, of course, the healers that are our nurses and doctors that are putting themselves in the front line. And then there's the weavers that are incorporating racial justice and climate change and all the other aspects that are affecting us into this narrative. So try to really remember where you're at on the circle. I will share a little worksheet that you can work out and see where you land. Of course, this is not all. These are just some of the major ones. There's a lot of subcategories that can be noticed within a lot of these movements. So try to really see where you're at and try to see where you can mobilize what you have as resources to better our space around us. And I'll leave you with this, that again, our emotions sometimes get the best of us, but both grief and gratitude can coexist, and that is okay, and we need to be able to mobilize it so we can help each other out in this process. Awesome, and with that, I'm gonna turn it over to, let's see, who is it? Tina has the eagle, and go from there. Thank you, everyone. Oh, shit. Did I just mute myself? Is this?
Okay, hold on just a minute, guys. Can you hear me?
Yes, we can.
Okay, all right. Well, I'm going to try to figure out how to do this. I need to upload a presentation. I guess I should wait, now hold on here. I'm kind of new to this Zoom stuff, so. Okay, here's a start video. Nope. Okay. Okay, I don't know how to upload. Can somebody explain to me how to upload on here?
Tina, hey Tina, can you hear me?
I can. Can you hear me? Oh, wait, now I can't hear you no more.
Okay, the best way
Oh,
to
now
do
I can.
it is just on the bottom of the screen, it will say share screen.
Okay.
If you go ahead and click that, it will open up your main screen there, and you'll be sharing with everyone.
Okay. Okay, it doesn't have it on there. Let me see.
There should be.
Okay, I did a, wait, now let me see here. Let me go down. I did a PowerPoint is what I did.
There should be a little button there for you with a green arrow.
Okay, I think I got it here. Hold on, let me see here.
Perfect.
Let me see if that's it. Yep,
Yeah.
this is it.
That's it.
Okay, I'd like to welcome you all today. My name is Tina Has the Eagle. I work for the Rocky Mountain Tribal Leaders Council here in Billings, Montana. And I thank everybody for the invite that was sent to me to give you a brief 10 minutes of some of the things that I do here for Rocky Mountain Tribal Leaders Council. One of the things I do is I work with Global Indigenous Council, and we work on the Missing and Murdered Indigenous Women and Girls campaign. As you see on the screen there, I have, there's 3 of us that, well, that's only part of us, but there's the Global Indigenous Council, the Rocky Mountain Tribal Leaders Council, and the Great Plains Tribal Chairmen's Association. This screen is just one of the logos that we have, not our native daughters. And it's, this is Global Indigenous Council, this is Great Plains, and then the Rocky Mountain Tribal Leaders. Okay, I'd like to start by a little information. It's not too much, it's like a cultural insight into the Native American families and lives. But back in the day in our culture and everything, the Native American lady, they was held to the highest standards that there can be, because according to our beliefs, the lady is the giver of life. The woman, the mother, she's the giver of life, and she's the one that brings the children. You know, she's the one that's there to cook the food. She's basically the caregiver of the whole family. So it was never heard of a Native American woman being beaten, slapped, killed, raped, murdered, you know, unless it was by another tribe. So that's just a brief insight into, you know, I didn't have very long to prepare this. I've been really busy like everybody else on this COVID-19 stuff. So I'm meeting with CDC and doing a lot of calls, but I hope this kind of gets to the point. It'll give you a little bit of insight into what we're doing with MMIW. To date, there are 12 states that are part of the Billboard campaign to help combat missing and murdered Indigenous women. Of the states involved so far, these have the highest incidences of MMIW. We will be going into Washington after the COVID-19 passes. There are too many names of our senators and congressmen that have backed us on this campaign to name, so I will direct you to the gallery at www.mmiw-gic.com. Part of the legislature that we have passed, we have helped get moving on both Savannah's Act and Not Invisible Act. They are not enacted yet. They have passed the Senate and are now going to the House. They will pass easily, but then will need to be reconciled after going to President Trump to sign. In North America, the US-Canadian border continues to impede progress on the murdered and missing Indigenous women and Two-Spirit tragedy. A lack of effective cooperation presently exists not only between law enforcement agencies, but also between tribal nations due to the status quo of jurisdictional paralysis. Now we have legislation at the federal and state levels. We must continue to unify the unified effort to see this passage into law. If we save one child from rape, if we save one teenage girl from sex slavery, if we save one Native woman from the hands of a murderer, this campaign will have succeeded. To the victims held in physical and emotional bondage, we will not abandon you. To the victims' families, we hear you. To those whose lives have been tragically taken, we will not forget you. On this page, I don't know how I'm going to do this, but these blue, the wide jurisdictions such as Sticking Point for MMIW, Get the Full Picture, and Global Indigenous, these are all, if I go over them, it'll show the websites and stuff. But you can go to www.globalindigenouscouncil.com, and they have tabs at the top that have the missing and murdered women campaign, and you can go into the pictures. There's all kinds of stuff that you can go on to there. This is one of our billboards from the Billboard campaign that we have in Rapid City, South Dakota. And this is our Invisible No More campaign that we started out. As of the date of printing and everything, we had 5,712 Native women who were reported murdered or missing in 2016. Now we've lost count. I'm going to try to go into this other screen here and see if I can, I don't know if I can save it or not, but I mean, if I can do this or not, but I'm going to try here. Okay, I don't think I'm going to be able to do this. Let me see. I'm really new to Zoom, guys, so. Okay, here it is. Okay, new share. Okay, here is just one of our screens that we've done. I mean, one of our, yeah, it's the documentary that we've done. It's called Somebody's Daughter. And as you can see on here, there's Vice President Biden. We've had Chairman Cedric Cromwell from the Mashpee Wampanoag. I'm sorry if I got that all wrong. But there's a lot of people. We've got John Tester, we've got Senator Daines, Representative Giaforte, Vice President Joe Biden, Mayor Pete Buttigieg, Congresswoman Deb Haaland. You can also go to, for our documentary on Somebody's Daughter, our preview of the documentary was held in Tucson, Arizona on January 11th, 2020. It turned out to be standing room only at that preview. There was so many people there. We did different things there, and we held a screening. Let me see, I can get you guys a... Okay, how do I go back to the screen of just me? Would it be stop video? I can't hear you. I can't hear you at all, Alex.
Oh, you're perfect, Tina. You're all good.
Okay.
It's just you on the screen now.
Okay, all right. And hold on, let me get onto this. Okay, and then I want to direct you guys to the website if you'd like to see Somebody's Daughter, the documentary. It's www.somebodiesdaughter-mmiw.com. And I'll also put it in the chat on the side here for those of you that would like to go check it out. Other than that, that is just a quick presentation. I just threw it together at the last minute. I don't know if anybody has any questions or comments. I hope you're all staying safe, stay sanitized, and we will all get through this COVID-19 pandemic, not epidemic, pandemic.
Perfect. Thank you, Tina has the Eagle. Jamar, do you want to jump on with me here?
Absolutely. Thank you very much for that. My name is Jamar Galbraith. My pronouns are he, him, his. I am with Empower Montana, as well as Missoula's Idea for Racial Justice. And Alex introduced himself a little bit earlier, but Alex will be joining me for this portion of our section. I'm just going to be pulling out. And so what I'm going to be doing is I will be taking a little bit of time. We've heard a lot of things today around resources. We've gotten a lot of history around systemic racism. And so what I would like for us to do now is I'd like to sort of guide us in an activity. And this activity is called the frame of reference. And I just want to make sure that everyone can see the screen here. Am I sharing the right thing? Awesome. So what I'll be doing is I'll be taking us through a frame of reference activity. And our frame of reference is really just an opportunity for us to engage in some thinking and some reflection around the various identities that we carry with us. And it's really important for us to be able to contextualize the work that we're doing with ourselves. We all have relationships to systems of oppression. We all have relationships to racism. We all have relationships to the current crisis that's going on. But the frame of reference is just an opportunity for us to really engage in some deep thought around the lenses that we carry, which again are these intersecting identities that we all hold, which inform our interactions with the world around us. And the frame of reference is really just an opportunity for us to begin building blocks of empathy. And so for just a moment, I'm going to introduce this activity, and then it'll be a sort of Q&A style with Alex going through some of these questions that we're going to pose with you all. And I invite you all throughout this time to reflect on these questions as well. I invite your answers here in the chat box as well. But please feel free to revisit this frame of reference activity throughout your lives. And again, as I mentioned before, we all have these intersecting identities that we carry with us that inform our interactions with the world, as well as how the world perceives and interacts with us. I like to think about, and sorry if I butcher this, but I was an English major, so I'm going to try a science analogy. We often, when we think of our identities, we think of them as a singular entity, like this is who I am. And I invite you all to suspend that and think about your identities as an atom. And as we all know, in the core of our atom, we have a nucleus, and that nucleus contains lots and lots of power and energy inside of it. And floating around that nucleus are protons and electrons, and as they navigate through time, space, and navigate through and around other atoms, they find themselves drawn to, repelled from, and sometimes ambivalent with other atoms, forming bonds with some, pushed away from others. But those atoms aren't destroyed as they form bonds or as they're pushed away. Instead, they continue to maneuver. They continue to maneuver around. And so our identities are very similar. We have these identities that inform our worldview and also inform how the world interacts with us, which may or may not be accurate from our point of view. But they're still there. They have informed our view of the world, and they continue to do so, even if we're not consciously aware of those at all times. And so too, our identities may shift. We may find our parts of our identity more salient at different parts of our lives, or maybe even different points of the day. And other times we may find parts of our identities that are pushed a little further back due to, which is where we are in our states. And so it's a very brief introduction for the frame of reference, and we're just going to jump in, and I'll just invite Alex the response to a few of these questions. And also remember too that no two sets of lenses are the same. We have these awesome glasses here. One because we're really cool and we needed something to work with this analogy with the frame of reference. But if you think about your prescription, these lenses of your prescriptions, then you are unable to see the world in the same way.
Jamar, do you want to share the screen with us?
Yes, I am sorry. Am I not sharing? Whoops. Sorry about that. And here we are. I just went through all of that and did not share the screen with you all. So I apologize. Can you all see the screen now?
Yes.
Excellent. So we'll just go ahead and jump right into it. For our first question, and again, I invite you all to reflect on these questions as well, perhaps answer them on your own, maybe even invite responses in the chat box. But Alex, would you mind sharing with us what are some of the significant lenses that build your frame of reference?
Yes. So for me, two significant lenses that I see there that really build my frame of reference is my race and ethnicity, especially during this time of pandemic. and also my place and location. I'm originally from the East Coast, and so you know, just where I am is just so different than where my friends and my family are, and so it's really, I've been just really thinking about where I am sitting today.
Excellent. Thank you. Thank you very much, Alex. We're moving to our next question. As we know, parts of our identities, we're able to feel confidence and strength in some aspects of our identities. So would you mind sharing with us a little bit about how some of your significant lenses give you strength and or confidence?
Absolutely. Again, my race and ethnicity is something that gives me strength and confidence, because I know that Asian Americans and Korean Americans are resilient and strong and smart and able to, you know, work to build confidence for our communities and for ourselves. And so that is a significant lens. Another thing would be life experiences. I think that we all have tons of life experiences, but I really look back on my own personal experiences, and I really think that that is a pillar of strength for me.
Excellent, Alex. Thank you very much. And as we know, we all have lots and lots of identities within us. And so we don't have all of the ones. We certainly couldn't list every identity that exists within these lenses here. So please, we invite you to think about some on your own. Moving on to the next question, because we are human beings and we are all very, very beautiful, complicated creatures, it's very possible for us to enjoy strengths in some aspects of our identities, and maybe even in the same aspects of our identities as we have challenges with. And so, Alex, would you mind sharing with us a little bit about how some of your significant lenses present or give you challenges or barriers?
Absolutely. One would be family. I am very far away from my family, and we did grow up. I'm a first generation Korean American, and so my parents immigrated to the United States. And so my lens is very much different than their lens. And due to that, that does present a lot of challenges, but it's a good working work in progress. And I would also say that a lens that presents some challenges for me is also my class. You know, I recognize during this time that it is financially really hard for a lot of people, including myself. And so I think about just the privilege I have in the class that I am in, but also in empathy of others that are not as fortunate and not as privileged as me.
Thank you. And so next, let's think a little bit about community, because we don't exist in isolation. Again, these frames of reference that we carry are not only identities that we ascribe to, but they are also identities that are prescribed to us as well. And so, would you mind chatting with us a little bit, Alex, about how your frame of reference informs your interactions with your community? Absolutely.
So even for you know, let's say my age, you know, when I relate to someone in my community that is older than me, I may not have experiences that they have had in their lives, you know, or if I am speaking to someone that is younger than me, you know, that person may have already had those experiences that I'm yet to have, or maybe I have had experiences that they have not had. And so age is definitely something that that I consider. Another thing is place and location, especially with COVID-19. You know, we are in Montana, and you know, I'm in Missoula, and you know, Missoula looks a lot different than people that are in San Francisco and Los Angeles and New York and DC. And so how I interact with people in this community looks a lot different than how people are interacting in their communities, you know, in other places. So that's definitely something that would inform my frame of reference.
Excellent. Thank you. And so now you mentioned, and again, you mentioned the COVID-19 and how COVID-19 is sort of informing your interactions with community. But what about for you? What are you mentioned some of those before, but what are some of the lenses that tend to be most salient or more at the forefront of your mind during the time of our COVID-19 pandemic?
Yeah, I think that I would like to go back to race and ethnicity for me. There is a lot of racism and bigotry and all of these negative things that are happening. And it's really hard not to consider my own race and my own identity. and my ethnicity during this time, because you know, watching the news, seeing it on the television, you know, it constantly reminds me that you know, I am a part of that community. And not only that, but you know, I also represent this community as well in my own life. And so I would say that is definitely a huge lens that I am looking through right now.
Excellent. And for our last question, let's sort of connect our identities to be able to spur us on to action. How are your significant lenses connected to deconstructing racism and xenophobia?
I think for me, race and ethnicity, again, is important. It's such an important lens right now for me personally. And how that can help deconstruct racism and xenophobia is by you know, I really welcome questions, and I welcome conversation, and I welcome people to ask me about my culture and my heritage and my race and ethnicity, because I think that by communicating through the racism and xenophobia that is happening right now, by using the lens that I have of being a Korean American, I think that that can really help to deconstruct what's going on right now. I think that by having conversations online or having conversations over the phone, obviously because we're not as able to meet in person during this time. So utilizing what we can to have these conversations about, and using my lens through my race and ethnicity and my lived experiences, I think that I can help to deconstruct some of the racism and xenophobia that we're seeing here today.
Excellent, Alex. Thank you. Thank you so much. And so as I wrap up, I want to make sure that I'm honoring our time. I want to again thank you all for being here and joining us on this webinar. I'd like to thank our incredible and amazing panelists. And again, just thinking around the frame of reference is again an opportunity for us to engage in some introspection and some reflection around how our identities are impacting us. And it's also an opportunity for us to really think about ourselves and to think well about ourselves. When we're navigating these tough times, it's really important for us to pay attention to what our identities are asking from us and sometimes demanding of us. I find myself, you know, in this time period of where, you know, I am no longer in the office as much. I find myself spending a lot of time with my family and engaging with them intentionally, as well as like uncovering that there's a lot of work that I would like to do with my family as well. And so when we give ourselves time to pay attention to what our identities are asking for us and requiring us, it opens up empathy. It opens up our ability to build those connections with other people, because we're giving ourselves the attention that we need. And we're also able to build those connections with other people. We don't expect people to be able to put themselves in other folks' experiences, but we are able to empathize and build on some shared experiences to create some shared value of our identities. And so in conclusion, just don't forget about yourselves during this time. Don't forget about the ones that are close to you, and allow yourselves some time to really reflect on your identities.
Thank you so much, Jamar, and thank you to everybody. I'm just going to close this out here. Thank you to everyone in attendance. Thank you to all of our panelists. Thank you to all the wonderful organizations. Please remember that during this time of isolation and pandemic, that the individual work you choose to do during this time to be anti-racist will have a great effect to all of us collectively, because COVID-19 does not see they or them. It affects us all because we are all humans. So please check out the links on the Facebook event. These organizations are doing work. There are so many other organizations that are doing great work. So there are different organizations we're all doing so many different things. So please engage. Please feel free to reach out. And we hope to hear and see all of you very soon.
Bye.
Yeah.
All right,
everyone.
bye.
Thank
Thank
you.
you.
Thank you.